let's talk about tooth whitening. What happens when you do that? All right, so typically when you whiten teeth, you have a tooth, and then you just literally shake the pigment out of the tooth, and this is why your tooth becomes whiter. So once you draw the pigment out of the tooth, you have pores where that pigment used to be, and those pores stretch all the way to the nerve of the tooth. And once you brush that tooth with air or cold water, sugar, salt, anything, it's sensitive. Yeah, that's right. Just because the pores are open now, the nerve will feel things just like water moving within the tooth. It'll activate that nerve. So how do you counteract that? So now your tooth is nice and white, and what you want to do is put some fluoride into those pores, because fluoride is a white substance. It's a white chemical. So you don't want to be eating something that is dense in pigment. No red wines, no pastas for the next 2 weeks after whitening. You just want to let it be. And what I tell my patients is leave the fluoridated toothpaste overnight so the fluoride can precipitate into those pores over the course of the night, so you have less sensitivity quickly. So you combat sensitivity that way. But you might ask me, Roman, they put a whole bunch of stuff and protection on your gums. Okay. Just like in root canals, we don't want chemicals touching your soft tissues, but your teeth are a lot more sturdy against the chemicals that we're about to use. So the chemicals don't harm the teeth, but they will burn the gums, right? Just because of high concentration. This is why we're protecting the soft tissue and letting the chemical interact with the hard tissue, because we mainly want to work on the hard tissue, not the soft tissue. I mean, would you want bleached gums? I wouldn't. No. Okay, so then they activate it with a blue light, the reactions happens, the pigment bleaches out, and then you have white teeth. Just make sure to keep it nice and easy for the next 2 weeks, because it will be sensitive during the procedure, it will be sensitive after the procedure. Brush with fluoridated toothpaste, leave it overnight, and that usually takes care of 90% of cases.